Hi, I'm Dr. Stephen Kim from UCLA, and I'm here at AWE here to demonstrate the Exalt Duodenoscope from Boston Scientific. This is the disposable duodenoscope that's now commercially available for use in duodenoscope procedures such as ERCP or when you need to use a side viewing scope to visualize the ampulla. So we're going to demonstrate this today. It works just like any other duodenoscope, right? So the wheels, the elevator are all the same as you'd expect on a duodenoscope. We have a model here where we're going to cannulate the bile duct, and then we'll show us passing different instruments through the Exalt duodenoscope. And essentially, you can do anything here that you can do on a normal reusable duodenoscope. All right, so we'll focus here on the Exalt image. You see the image quality is very high quality, right? Just as you'd expect. So we're going to cannulate this plastic model ampulla with a sphincter tominal wire. The wire has gone up.
You cannulated already?
I'm cannulated. So easy with the Exalt duodenoscope. All right. The elevator actually works really well with the Exalt. I can just pull this, hold the elevator down, and the wire will not move.
So
I think it's one of the best features.
Lock, huh?
Yeah, it's one of the best features of this.
Look at that.
I can just pull this out by holding the elevator down. My wire will not move. All right, so I got the wire. And let's maybe pass the spy. Oh, I didn't realize it was a short wire. And we're going to now pass the spy scope, the spyglass, cholangioscope, down the Exalt. And you'll see we can pass, this larger, stiffer diameter.
Do you have any problems passing it?
No.
Have you had any issues?
No issues. I mean, I think just like any other device, you have to learn some of the properties of this device relative to the other ones, right? So I think there are a couple of kind of tips and tricks you can use with this duodenoscope as opposed to maybe the reusable one that you're used to. Certainly when it comes down to passing some of these larger, stiffer instruments such as the spyglass cholangioscope, I find that when we're in real time in a patient, it often helps to go little dial to the right. It helps you get underneath the papilla more. It helps you cannulate or intubate the bile duct with this stiffer device. So it's a plastic model. I don't know if you can see some of this spyglass image now, because obviously the duodenoscope image is going to be pretty similar, the same. But I can pass this spyscope up. I'm now in the bile duct here. And what do you know? There's a big stone right in the bile duct. All right?
Is the HL coming out right now?
So we don't have EHL on this model, but we can use a spy basket to try getting this out. All right? So let's exchange out the wire. We're going to use some of these spy accessories. So Spyglass now has a bunch of accessories. They got forceps, EHL, laser, snare, baskets. So we're going to use the basket here to grab this stone and help pull it out, right? Sometimes you get these stones that are really hard to remove. You've done a ton of balloon sweeps and you can't get it out because the duct is really big. The balloon is passing, the stone is passing around the balloon. You can just put the spy scope up, visualize the stone, and then grab it with the basket.
And ultimately, it's potentially UARCP without fluoroscopy.
You could, exactly. I mean, this is cholangioscopy. To me, cholangioscopy is analogous to colonoscopy, and cholangiography is like doing a baromenema, right? Like, why do baromenema? We can actually visualize the colon. Same idea here. Why use cholangiography when you can use cholangioscopy and visualize the bile duct?
Oh, I'm going to steal that analogy.
Okay, open. We're going to open the basket here. Okay, close. Oh, sorry. Open. Close. We got this beautiful stone right in the basket here. We're going to pull the spyglass out, and then on the Exalt image, you're going to see the stone pop out into the duodenum.
We're hearing applause almost in the room.
Thank you, thank you.
It's coming out.
Right here, we should visualize it.
The delivery there.
There's a stone, right?
I actually really like that for pregnant patients when we do ERCP.
You want to limit fluoroscopy? It's a great option. No fluoroscopy. No fluoroscopy, even better.
No fluoroscopy.
All right, let's drop the stone in the duodenum. So open. And there it goes.
Life is good.
All right.
Well, thank you so much.
Sure.
That was really good.
So this is the Exalt Duodenoscope. Obviously, the main purpose of this is that it's disposable. So it's a one-time use only. Once you're done, you throw it away. You don't have to worry about reprocessing the scope. And so I'd say in general that the patients where you may want to consider using it are those who are higher risk for infection. So patients with cholangiocarcinoma, immunosuppressed, post-transplant patients, those are the patients who may want to consider using this scope because they're at higher risk for getting an infection, much lower risk of infection if it's a one-time use scope.
Well, thank you so much.
All right, thank you, Dr. Reicher. Thank you.